Qualified, professional, and compassionate doctors talking real solutions to real health problems.
I am excited this evening because we are going to be learning as usual on the Doctalk show, the show that is brought to you by the National Medical Stores and Camelin Men's Collection. We are hosting anesthesiologists, a special type of doctors who are going to tell us what exactly they get to do, but on a topic that is very, very important, especially to family and surrounding the joy of bringing additions in family. Dr. Atumanya Patience and Dr. Andrew Emedu, you're very, very welcome. Kindly introduce yourselves to our guests.
I'm Dr. Andrew Emiedu, an anesthesiologist at Bethany Hospital.
I'm Dr. Patience Atumanya. I'm an anesthesiologist based at the Uganda Cancer Institute.
Welcome, our doctors. Childbirth is such an important journey for every mother and every family. It is such a joyful experience, and we usually celebrate. Of recent, we are having bridal showers, then there is a baby shower. I'm very sure people are going to even start having preconception showers, yeah, something of that sort. But bringing a child into this world is a very painful experience for some women. And in my circles, we have started praying for people to start having Hebrew births. Apparently, those people get into labor and the baby comes out, because sometimes there are effects that surround the labor process, and one of those is the labor pain. Yet, it is very, very crucial for a mother to start bonding with their newborn and to also start breastfeeding early after birth. This special group of doctors deal with a lot of pain and making really situations and medicine really comfortable. Dr. Patience, who is an anesthesiologist? What kind of work are you into? Yeah.
Thank you, Kathy. So an anesthesiologist is commonly known as a musilisa in our Ugandan setting.
Yeah.
But for the most part, it's something that is not very understood as what we do. Probably that's one of the reasons why we're here. So an anesthesiologist is a medical doctor who has specialized in anesthesia and critical care.
Yeah.
So what we tend to do for the most part, you find that we are the center of the entire medical subspecialties, whether it's pediatrics, internal medicine, surgery, everything. We have our tentacles in all those specialties. Our primary role will majorly be centered in the operating room,
Yeah.
where we make sure that the patients are taken care of, they're safe, they're pain-free, and they undergo the operations as comfortably and safely as possible.
Yes.
Now, you have the other arm, which is the critical care, and that's where we deal with patients who are in the HDU, high dependency units, the intensive care units. I think that came out more pronounced in the COVID era, where most people, found out about these doctors. And then we have the pain aspect of anesthesia, where we'll handle both the acute, which is something that has happened in a short period of time, and that's where things like the painless labor services come into play. You have the post-surgical pain, and then you have the chronic pain, where we tend to handle patients who have had long-standing pains for quite some time, cancer pains, back pains, bone pains here and there. So in a nutshell, you'll find that we handle all specialties in different ways in those kind of three categories. If you have pain, operating room, and critical care.
Yeah. Thank you so much, Dr. Atumanya. And actually, usually people present to hospital because of pain, and in many cases, especially as the surgeons, we are seeing that people who have conditions that are painless, they will not actually present until they start feeling pain. And there is a lot of myths and beliefs, especially about labor pain. Some people believe that this is natural, and actually when we look at Genesis 3:16, when God found out that Eve had, it's in the Bible, when God found out that Eve had eaten of the forbidden fruit, he commanded that he will actually multiply Eve's pain as she brought forth offspring. So people find it natural. But also there is all this culture and societal expectation that this is the opportunity of a woman to show that they are strong, yeah, to know that they are of courage, that they are going to be able to make good mothers and, you know, withstand different challenges in life. So women, as they go through this process, they see it as an opportunity for them to show forth their character. And so very many women don't mind having this pain. Yet for some, it is actually very, very excruciating, and it can actually hinder even their bonded with a child. Yeah, they can have lasting physiological damages and changes. And this evening, as we are discussing painless normal labor and delivery, Dr. Andrew would like to know, why does a woman get into labor, and is it important?
Thank you, Dr. Kathy. So pregnancy should last a particular period of time, usually 9 months. So the womb will hold a baby for that duration of time. And when the time comes for you to deliver, there will be some hormonal changes in the body, and you have an excess of a hormone called oxytocin, which then causes uterine contractions. So the womb itself then starts to contract, and as that progresses, early in labor, the contractions are not so strong. They're like menstrual cramps, but then they become stronger and stronger as labor progresses. Then eventually you have the cervix, which is the opening to the womb. It will start to open up. In the medical terms, we usually grade it from 0 to 10 centimeters. 10 centimeters is when it's fully open and the baby can actually pass and come into this world. So the pain that a woman feels during labor is usually from the uterus itself, the womb contracting, and also from the birth canal as the baby is trying to pass. That pain is usually mild at the start. It becomes more severe beyond 4 centimeters. That's when we term you as someone who has gone into active labor. Then when you reach 10 centimeters, which is when the womb is fully open, you have excruciating pain. It's undescribable around this time. So, and it's what most of our parents went through when they were delivering us, but times have changed. There is a lot of technology out there that is trying to help the woman have a more, pleasurable experience of childbirth. Yes.
Thank you so much, Dr. Andrew. And we've learned what that labor is and what actually brings it, and why it is important. It facilitates, or it shows that actually someone is going to be able to bring a baby into this world. Thank you so much, Dr. Patience and Dr. Emedio, for telling us what you guys do and the importance of your work in our settings, and what labor is, and also the pain that is associated with labor. We are going to be back from a short break, and I encourage you to encourage everybody, everybody to actually tune in into this show, because this is exciting news to actually learn that we can have painless normal delivery. So invite your friends, your neighbors, everybody to actually tune in into this Doctalk show. We are going to be back.
You are watching the Doctalk show.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
You are watching the Doctalk show.
Welcome back to the show. This is already exciting. I am very optimistic about my journey to motherhood, and we are going to be able to learn about this painless labor. Dr. Atumanya, what options are available to achieve painless labor?
All right. Thank you. We've been talking about this for a while, how to get it out there to the public and, you know, get them informed and not suffer, you know, while they're having their babies. So we have quite a number of options. Some will work perfectly, some will relieve pain, you know, for a brief period of time, but, you know, anything that can reduce it by even 0.5 is something quite important. Yeah. So if you ask any mother who has gone through labor, they will probably usually explain it as the most excruciating kind of pain that they've gone through. And so we have options. We'll have those that are non-pharmacological, or if I may put it, things that don't need medicines, but they do tend to help alleviate this pain. Things like music therapy. You notice if you're sad and you listen to music, it you know, it tends to help your mood. True. Massages, like if the husbands are available and they massage the patient's back during the, you know, the labor pains, it tends to give the mothers a bit of a smile, you know, to go through that pain. Things like changing position. You might have some yoga balls, so they keep on bouncing on them, and see, some will say that it kind of helps. Then you find some opt for things like water baths. And, you know, they will say hydrotherapy, it helps relieve their pain, and that's something that they can go forward with. Things like meditation, and this really is something that you've practiced beforehand, and you used, it's something that can calm you and get you through certain hard conditions. You know.
Even breathing exercise.
Oh yes, even breathing. I tell you, breathe in, take deep breaths, and that kind of takes your mind off the painful kind of stimulus you're going through, and gets you through the contractions, which is pretty good.
And people already practice these things. Yeah, because we've seen in wards, we take ladies to, you know, breathe in and out, because we know we don't want them to go through that very severe pain. So people actually already want to undergo painless labor.
So and then
so maybe for how those work. So for most of those, you know, the nerves that carry the pain impulses from the womb all the way to the brain, they converge at a particular point in the spine. So the same nerves that carry touch, temperature, and pressure, they all converge in that area. So if you flood that area with many impulses other than pain, the pain tends to reduce. Yes, and for the breathing exercises, whatever is happening to your body is out of your control, really. So if at least you can control your breathing, it gives you a semblance of control of whatever is happening.
And some relief.
Yes. And you can actually combine all those things. You can have music therapy, you can be in a water tub, or you can take a hot shower. Oh, yes. But those can only help reduce pain to a small degree. So what we usually think is more, you know, superior to all that is the pharmacological techniques. So these simply require us to use actual medicine. So the first one is morphine. It's an opioid that is used in some places, but we don't use it because it can cross over and to your baby. So when the baby comes out, the baby will be, you know, having shallower breaths, or will be tired, basically. So we don't advocate for that. But what we can do is nitrous oxide. It's a gas. It comes in a cylinder mixed with oxygen, so it's called entonox. So you can breathe in and out. It's connected to a tubing and then to maybe a face mask or something. So when the labor pain increases, you take faster breaths. When the pain is less, you take shallower breaths. At some point, when the pain is too much, you just stay on the mask all through. It helps reduce the pain. We use it in theater as part of the anesthesia. So we don't use it in most hospitals because they are not so readily available. But what we do is called epidurals. So epidural analgesia in this case is the most superior and also the most invasive form of pain management during labor.
Yes. So what is this epidural, and how does it get to work to relieve the pain so that our lady can have a smooth and happy delivery?
Okay, I'll take the first part of that. So before we talk about the epidural, which Dr. Patience will explain, you need to know about what most people know is the spinal anesthesia. So people who are watching the show mostly are going to be maybe pregnant or at some point will get pregnant, but what they commonly know is the injection that we give to the pregnant mothers when they're going to have a cesarean section. So the back is made up of many bones, about 24, 28, 26 bones, which are stacked together and held in place by ligaments. When you sit properly and bend forward just enough, you open up spaces that are already there between those bones. So we advance a needle through those spaces into a space that actually has fluid. So it has that fluid, and then within there we administer some medicine, numbing medicine. It's a higher concentration, so we give that medicine, and the goal in this case is to numb you from, say, the nipple line down. It basically paralyzes you so that you don't feel any touch, any movement at all, and you can safely have a cesarean section done. So for the epidural, it ends up at a space just above. It's the same exact thing, but the end point is different. So you end at a space just above where that fluid is. It's called the epidural space.
Yes. So Dr. Patience, how then does that drug that is at that point work to achieve painless labor?
I guess I can just try to build on from what Dr. Andrew has said. So like he has explained, we have what we call the spinal cord, and then you have the water that surrounds the spinal cord, or what most people will commonly say amazi mumugongo, something like that. Now it's covered, all that, the water and the spinal cord is covered in a sac, right? Now with the epidural anesthetic or the epidural technique that we use, we go just outside this sac. Okay. Now, of course, the aim of doing all these things is to block off the nerves that send pain to the mother. So if we go outside the sac, the nerves come off from the spinal cord through the sac and just surround, they're all in that area. Okay. Now, when we go outside the sac, we give the drug in that area. So we use a needle and then we push a catheter through the needle, very thin catheter, and so that we can continuously give drugs through it. Now we take out the needle and just leave the catheter in. The catheter or the tube that you can give drugs through is just going to be seated in that space. There's nothing that is going to do minus sit, so that it can allow medicine to go through this catheter, and then we progress with the labor. Now, the same way we give, say, when you go to a dentist, we give you a drug in the gum so that it numbs the area. It's the same medicine or same brand of drugs that we'll give through this catheter into this outside the sac, which is the epidural space, so that we can block off these nerves that send pain to the lady's abdomen so that she feels the pain. Once we block them off, initially we start with a very small concentration that just blocks off the nerves and pain, but your legs are still able to move. You can walk around. You can feel the contractions going through because you feel it tightening, but it shouldn't cause pain. Okay, so that's in brief or in summary how an epidural works.
Wow, that is super amazing, and I am glad that the National Medical Stores and Camelin Men's Collection sponsor this show, because we are getting lots of knowledge, and which we are going to apply and thrive and be healthy even during a normal process like childbirth. Do not go away. We are going to be back.
You are watching the Doctalk Show.
Getting a birth certificate is as easy as 1, 2, 3. 1. Get a birth notification record stamped by a medical officer from a medical facility where the baby was born, or from a sub-county chief if the birth occurred in the community. 2. Go to the NERA offices in your area and present the notification record, a copy of the parents' or guardian's national ID, and a bank payment slip of 5,000 shillings for citizens and $40 for non-citizens. 3. Apply by filing NERA Form 3 from NERA offices or download it from the NERA website www.nera.go.ug. A birth certificate will then be issued to you. Birth certificates to refugees born in Uganda are free of charge. This message is brought to you by NERA.
You are watching the Doctalk show.
Welcome back. I told you this is exciting. So if you have not shared the link, please do share the link. Share our Twitter link on the Facebook Live page. You can also ask someone to tune in on UBC because this is exciting. Dr. Emedio, what are the benefits of actually this epidural and achieving painless labor for a woman, for her family, and for everyone really, even the healthcare workers, I guess?
Okay. Thank you, Dr. Kathy. So, first of all, like we have already said, pain during labor is always described as the most excruciating kind of pain that someone has ever felt. Yeah. And most people fear to actually get pregnant because of the pain. So what we are trying to inform the public about is the available options to reduce that pain. The main goal is for the woman to actually have a nice experience of childbirth. You can interact with family during labor because most of the time when someone is in labor and they are in pain, they are unpleasant to be around. Yeah, sure. So most people are going to avoid you. The husband will leave, the sister will leave. Yeah. So if someone is having a normal delivery but is pain-free, you'll find, from our experience, we've noticed that people that are having a normal pain-free delivery tend to have more people around them. From the in-laws, the husband, the friends, they come, they take pictures if they want. Yeah. So it allows you to, first of all, enjoy the experience. Then you also interact with your immediate relatives and friends during this period.
That is cool stuff.
I know. And you can even tweet about it and say, oh, I'm having labor with a full face beat and you're really looking good.
That is so wonderful.
Why not?
Yes. So, Dr. Atubanya, at what point in my labor do I actually get to have this epidural placed?
All right. So we, I'll just break it into maybe like 2 types of patients that we are dealing with.
Yeah.
So for the most part, we'll tell you, we can start at 4 centimeters. That is, when you talked about the cervix opening from 0 to 10. Yeah. Now at 4, we will say, fine, we are sure the labor has started and we are not going to go backwards. Yeah. The reason we do that, especially for those where it's their first pregnancy, is so that we don't now rush to put the epidural and then we find it's false labor, because that can happen. You have contractions. It's like the initial part, the pains are not as strong. It's like menstrual cramps, I would say. Yeah. And then once we are certain now, the cervix has opened, it's not going to close again, then we can place the epidural and now monitor for the progress of labor. Yeah. Now that's for the patient who has not delivered before and is in, first experience. Yeah. Now we have the other types. We have the lady who has delivered before. For the most part, once they start having contractions, you're sure most of the time that the labor will progress. Yeah. So if they start having strong contractions, then we can actually place the epidural. Even though they are maybe like 3 centimeters, we can place that and know, it's going forward, it's not going backwards. Wow. Then you have those where they are going to induce labor. Yeah. To induce is to artificially simulate the natural labor, the contractions and the natural progress of labor. Now, by the time we say, okay, fine, we're going to induce the labor or we're going to stimulate it, then you're certain you're not going to go backwards. Yeah. And those artificial medications and ways of simulating labor are pretty painful. So we place it as soon as they start having contractions.
Wow.
Yeah.
So if I'm not feeling the labor pains, how will I know that it's time for me to push? Because people might be worried that the baby may fall down, you know. So when do I know that it is time for me to push?
Okay, so we've had quite a number of those questions, but thank you very much for actually, first of all, for having us on this show, so we can help everyone else understand what goes on. So, like Dr. Patience said, most how this epidural works, the numbing medicine simply blocks off the transmission of the pain signals from the womb to the brain. So it does not really take away the contractions. What we are trying to do here is not take away the contractions. The contractions are actually ongoing all through the process. And the person actually feels some of it. So what we do now is called a walking epidural. So the concentration of the blocking of the numbing medicine that we use is usually much lower than the one we use for the normal spinal anesthetic. So because the goal is basically to take away pain. The contractions are ongoing. So the mother can actually tell you. They will feel something tense up in the abdomen. That's usually a contraction. It comes and then it goes like a normal contraction. Yeah. So they will feel that, and they'll also feel the pressure as the baby is being pushed down.
Okay.
Yes.
And you know, there are monitors actually that we use during the contractions, because we also want to be aware of what's going on. They'll have like a halter around their tummy that will measure how the contractions are going and how the baby is doing. So it's an ongoing process. They can't just out of the blue pop the baby. Yeah, it will continuously be
so that baby will definitely not fall out.
No.
And doesn't this labor usually last longer? Because some women may prefer to have intense labor for like 2 hours as compared to labor with for longer hours, maybe like an entire day with an epidural. So doesn't it last longer?
So we have done a number of studies on this.
Yeah.
So labor for a first-time mother will take, say, 18 to 24 hours. For a second-time mother, it may take maybe 16 to 18 hours. So the epidural that we do for this particular procedure does not shorten labor. It does not prolong labor in any way whatsoever. So it doesn't. It just takes away the pain. It doesn't affect how long your labor is going to take. Yes.
Dr. Atmanya, a baby is safe really with this epidural. Yeah, some people may actually think that the epidural may actually harm their baby. So is the safety of the baby guaranteed with this epidural?
Yes, the baby is going to be safe even when you're having your epidural, because the drugs we use, for the most part, they don't cross over to the placenta. They don't go through into the baby. So that's how safe it is. And like we mentioned, the baby is constantly monitored, and you'll find that these patients who are having an epidural are going to get more care compared to the ones who actually don't have an epidural, because it's something new and you're worried and you need to be sure everything is going well. So you find, the baby is top priority, and if there's anything that happens, it will be picked up very quickly. But if I'm to say epidural baby, no, there's no correlation. But you always have to remember, if you're having normal labor, any complication that could happen can happen. Yeah. Irrespective of whether you have an epidural or not. The only drug that would be say the opioids like morphine, which we talked about in the initial part, and that's why we don't like using it, because we know if you give it, then it can easily cross and give us a baby that is a bit, that takes a bit of that morphine, so they get the complications of morphine. But epidural, no correlation with the baby.
And also, since from the things that we do, since our field crosses over to almost every other field, we are also trained in how to actually take care of babies. So if a baby is born and for many reasons requires resuscitation, we can still do that, along with, of course, the obstetrician. And so generally, if you have this service, you will have a bigger team. You will have the obstetrician, you will have the anesthesiologist and a well-trained midwife. So you have an extra person who can actually take care of the baby in case they require that. But the epidural per se doesn't really affect the baby.
Wow. I think I am right to start advocating that instead of throwing fancy baby showers for people,
Yeah.
we can
Contribute
give them
to the epidural man.
an
Yes.
epidural service. We
Yes.
collect money
An
and
epidural shower.
yeah, an
Yeah.
epidural shower. Really. Thank you to National Medical Stores and Camelin Men's Collection for sponsoring this show. Do not go away. We are going to be back.
You are watching the Doctalk Show.
I remember the lockdown, when the streets were empty and our lives disrupted, when businesses closed and our livelihoods hung in the balance. Hospitals were full. We lost loved ones, jobs, and hope. Our children couldn't study anymore. We cannot let this happen again. We should not go back. Get fully vaccinated against COVID-19 and join the millions of Ugandans who are already vaccinated.
You are watching the Doctalk Show.
This is the most engaging Doctalk show that I have been privileged to host. We are having very many questions coming in from our viewers, and I'm going to try and ask a few of these questions so that our wonderful anesthesiologists can answer them. Helen Chikonyogo from Namagoma is asking, how long does this epidural last after it has been placed?
Okay. Thank you, Helen, for that question. It's a very nice question. So, what we do when someone has asked for this service, we place the epidural, and like Dr. Patience said, we advance a small tubing through the needle. It's a catheter. We advance it and then we tape it on your back. So the reason for that is so that we can keep administering medicine all through your labor period. So the pain during labor keeps varying as the labor progresses. Yes, so our medicine also has to keep changing. We have to change the concentration or the volume of what we are giving so that we keep you pain-free all through that period. So when someone calls me, for instance, I'm not going to come and give them one injection and then leave, which is what people think. No, we actually have to stay until the baby comes. So it lasts the entire period, from the time we place it till the end.
All right. Thank you so much, Dr. Emedio, for answering that. There are so many questions that are coming through. Paula from Kisoro would like to know, what are the complications that are associated with epidural analgesia for labor?
All right. Thank you, Paula, for the question. That is something that we commonly get asked a lot when you're dealing with women. And like any surgical procedure or any medical intervention, there will always be benefits and risks, right? Now, we'll have a couple, and we'll talk about them in passing. So one of them is the back pain. It is something that the women will commonly worry about. And yet, when you look at the studies that have been done, you find that a majority of the patients or the women who are pregnant and have delivered will have a component of back pain. By the nature of how pregnancy is, you have the tummy protruding and the spine bends way too much. So they will definitely get pain. And the epidural back pain that happens is supposed to be short-lived because of the prequel we've passed the needle, and within the 24 hours that is associated with the epidural should have passed by then. The second thing that women will worry about is the headache, the post epidural headache that they will experience. You'll find that about 1 in 100 women might get the headache. And even when they get that headache, it's not that severe. The severe aspect is so small that you might actually have the headache and you're still doing your activities of daily living.
Yeah.
For those that get the severe headache, then we give them painkillers. We still other people who manage that kind of headache. So you get in touch with the anesthesiologist that provided you with those services. We give you painkillers, and in case you need to come into hospital, you come in. We still take care of you and make sure that that doesn't go ahead.
So maybe more to that. So the headache that could occur is like from the first part of the talk where we talked about the epidural space and the spinal. So if the needle goes beyond where it's supposed to end into that space where there is fluid, that's when you're most likely to get the headache. But we have special needles and special syringes that help us identify that space properly so that we don't really go beyond that space. So it's called post-dural puncture headache, yeah? And it commonly occurs in like teaching institutions because people are learning how this is done. But for private practice where we do all these things, we are usually well trained and we rarely go beyond where it's supposed to go. But the headache will come in only when we go beyond that space.
Yeah, thank you for that. Then the other thing that could happen is things like being unable to walk, and that is while the epidural is still going on. When we say that, it doesn't mean that we've paralyzed you, no. The drugs we give, because they numb the nerves, as the labor progresses, as much as we start with a small dose of the drug, as the labor progresses and the contractions get stronger, you might need higher concentrations of the drugs that might make your legs a little weak. But that is something temporary. As soon as we stop giving the drugs, it's like when you go to a dentist, they give you an injection and that wears off and you're able to use your legs quite immediately. The other thing is things like infections, but those we're always very sterile. It's a sterile procedure. We make sure the back is nicely cleaned with antiseptics, about 3 of them, so that we minimize that risk of getting an infection. And maybe the other thing I can talk about is the itching, because when we do the epidural and say you've gone through, the regular delivery, in case you get a tear or that kind of pain that happens after the contractions, we add a drug like morphine, okay, so that it can give you a nice pain-free 24 hours after your delivery. And for some patients, they might cause a little itching, just nuisanceal itching, but as long as they have no pain, that's as much as we can talk about.
Wow.
Maybe Andrew, if you have some more.
Yes, one of the questions I've been asked is whether one of the common myths about it is if you get that needle, you will get paralyzed and won't be able to walk ever again. So whatever we do, so the spinal cord itself ends like on the upper 2/3 of the back. So everything that we're talking about is done like on the lower third. So we are not going to poke, we're not going anywhere near your spinal cord itself. So we are out of that space. So we are not likely to paralyze you using this epidural. And also, like we said, most of the medicine that we are using is short-lived. It wears